Do you think your dog's bad breath is just dog breath? Something normal, maybe a little gross, but even kind of funny? Just part of the deal when you have a four-legged friend? If so, you're mistaken, and it's a dangerous mistake. That smell you've learned to ignore is actually the first warning sign. It's a warning that something could be silently attacking your dog's heart, kidneys, and liver right now. It's just the tip of the iceberg of a killer that, according to studies, affects nearly 80% of dogs over 3 years old, and most owners, maybe like you, have no idea about the damage until the damage is severe. Stay with me because I'm going to show you what this is all about, how it becomes a deadly traveler inside your best friend's body, and most importantly, how you can stop it in its tracks. What you're going to learn today could literally save their life. Plaque, tartar, and the lie we believe. Alright, let's go to the root of the problem, your dog's mouth. It all starts in a super innocent way. After eating, food remnants mixed with saliva and bacteria, forming a sticky and visible film over the teeth. That's dental plaque. I'm sure you felt something similar on your own teeth when you wake up. If that plaque isn't removed within the next 24 to 48 hours, it starts to harden. The minerals in saliva calcify it, turning it into a hard yellow or brown crust that clings to the teeth. That, my friends, is tartar. Once tartar appears, no amount of brushing at home will get rid of it. This is where the big confusion starts. A lot of owners see the tartar and think, well, it's just stains on the teeth, it's not a big deal. They notice that increasingly strong smell, halitosis, and joke about the classic dog breath. But what's really happening is a full-scale bacterial war. Tartar is like the perfect hiding place for bad bacteria. It gives them a safe spot to multiply out of control. This bacteria party starts to irritate the gum line. The gums, which should be pink and healthy, turn red, get swollen, and bleed easily. This is called gingivitis or stomatitis, the first stage of dental disease, and it's the last warning your dog's body will give you before the real killer's unleashed. And this is when a bad breath problem turns into a silent medical emergency. If you ignore stomatitis, it progresses to what's known as periodontal disease. Periodontal means around the tooth, and the disease does exactly that. It destroys everything that holds the tooth in place. The bacteria, well protected by tartar, start digging tunnels under the gums. They create deep pockets where the most dangerous bacteria, the ones that don't need oxygen, set up camp. There, they start to devour the gum tissue, the ligament that connects the tooth to the bone, and eventually the jawbone itself. Your dog might start to feel terrible pain when chewing, maybe stop playing with chew toys, or even begin to lose teeth. But even that isn't the worst part. The real plot twist, the one that gives this video its name, is what happens next. Imagine those inflamed, bleeding gums, not as just a wound in the mouth, but as a wide open door to your dog's bloodstream. Every time your dog chews, every time those gums bleed, millions of aggressive bacteria slip straight into their blood. Once inside, they have a first-class highway straight to the most vital organs. The first stop is the heart. The bacteria can stick to the heart valves, causing a serious infection called endocarditis. This condition damages the valves, makes it harder for the heart to pump blood, and can end in heart failure. Literally, the infection in their mouth is making their heart sick. The second stop is the kidneys. The kidneys are the body's filters, and having to clean blood full of bacteria over and over again causes them to become inflamed and damaged. This can lead to chronic kidney disease, which is serious and progressive. And the third major organ affected is the liver. Just like the kidneys, the liver struggles to detoxify the body, and a constant bacterial invasion from the mouth can cause inflammation and liver damage. This is periodontal disease. At first, there are no clear symptoms. Your dog isn't going to tell you that their kidneys are starting to fail or that their heart is working twice as hard. They'll just have bad breath. And by the time symptoms of heart or kidney disease appear, the damage is usually severe and irreversible. Some breeds, especially small ones like Yorkshires, Poodles, or Chihuahuas, and flat-faced breeds like Bulldogs or Pugs, are even more prone to it because of the shape of their mouths and crowded teeth. But don't be fooled by their size. No dog is safe. Now that you understand how serious this is, it's normal to feel a bit overwhelmed or scared, but I want you to use that energy to take action. Because the good news, the incredibly good news, is that you have the power to prevent all of it. Prevention is your best weapon, and it's fought on two fronts: what you do at home and when you need professional help. Let's talk about what you can do today. The most important thing, what really works and is non-negotiable, is regular toothbrushing, because the movement of the brush is the only way to sweep away that sticky plaque every day before it turns into tartar. Ideally, you should do it daily, but even brushing 3 or 4 times a week makes a huge difference. But what if my dog hates having their mouth touched? Right, the key is that it's not a fight. You have to turn it into a positive moment and take it step by step. Here's a plan. Step 1, get them used to being touched. For a few days, maybe even weeks, just gently touch their muzzle and lips, speaking calmly and with the brush, of course. Then lift their lip for a few seconds. Every time they do it well, give them a treat. Step 2, introduce the toothpaste. Never, ever use human toothpaste. It's toxic for them. Buy a dog toothpaste which comes in flavors they love, like chicken or beef. Put a little on your finger and let them lick it. Repeat that for several days. Step 3, rub without the brush. Once they like the toothpaste, wrap your finger in a silicone finger brush, put some toothpaste on it, and gently rub their teeth, especially the canines and back molars, since that's where the most tartar builds up. Step 4, time for brushing. Finally, it's time for the dog toothbrush. Put some toothpaste on, let them lick it, and then, using gentle circular motions, brush the outside of their teeth. At first, don't stress about the inside surfaces. Their tongue already helps clean there. The whole process doesn't need to take more than 1 or 2 minutes. Do it right before something they love, like going for a walk or playing. Now, what else can you use to help? Dental kibble. There are foods with larger kibbles and a special texture that makes the dog chew more, creating a natural brushing effect. There are water additives and gels, products you add to their water or apply to their gums to reduce bacteria. They're an extra help, but their effect is limited if used alone, of course. Combining brushing with 1 or 2 of these aids will create a powerful protective shield for your dog's health. And what if tartar has already taken over? If your dog's teeth are already brown and their breath is unbearable, in that case, you need professional intervention. No amount of brushing or homemade treats can remove tartar once it's as hard as a rock. If you try to scrape it off yourself, you're very likely to hurt their gums or damage the enamel. Make an appointment with your vet if you see yellow or brown tartar that's visible to the naked eye, very strong bad breath that doesn't go away, red, swollen, or bleeding gums, trouble eating, chewing only on one side, or dropping food, or if it hurts or your dog complains when you try to touch their mouth. The vet will perform a professional dental cleaning. And yes, this is done under general anesthesia. I know the word anesthesia is really scary, but it's absolutely necessary. Most of the problem, and the most serious part, happens below the gum line, a place that's impossible to reach with the dog awake and moving. Modern anesthesia, with pre-checks and constant monitoring, is very safe. It allows the vet to use ultrasound to break up and remove all the tartar, even the stuff that's hidden. Then they'll polish the teeth to make the surface smooth so plaque has a harder time sticking again. Ignoring the need for a cleaning out of fear of anesthesia is like leaving the door open for periodontal disease to keep progressing. Your dog's health is literally in your hands. That dog breath isn't a joke to you anymore. Now, you know it's a cry for help, so here's your mission. From now on, 1, lift your dog's lip and take a look. Be honest about what you see. 2, buy a toothbrush and toothpaste for dogs and start getting your pup used to it calmly and patiently. And 3, if there's a lot of tartar or the gums are inflamed, call your vet right away. Don't let a problem that can be prevented take years off your best friend's life. By taking care of their teeth, you're protecting their heart, their kidneys, and their future by your side. Tell me in the comments, are you going to start checking and brushing your dog's teeth from today? Your comment could be the inspiration another pet owner needs to take action. And if this video has opened your eyes, subscribe and hit the bell, because our mission is to give you the tools you need so your pet can have the long, healthy, and happy life they deserve.